Top health officials sounding the alarm on the Zika virus, revealing the type of mosquitoes that spread the virus. They are now in 30 states. Officials warning as they learn more about the virus, they find it even scarier than initially thought. Here now is Dr. Kevin Campbell. He's a practicing cardiologist and assistant professor of medicine at the University of North Carolina. Thank you for joining us.
Thanks so much for having me.
So, Dr. Campbell, the CDC, they've declared a level 1 emergency. We hear 30 states now have these mosquitoes in them. What exactly is a level 1 emergency, and why have they done that?
You know, that is the highest level of public health alert that the CDC issues. They did that a few years ago with the H1N1 flu. They did it during Hurricane Katrina and the fallout of that. So it is a big deal. It means that lots of resources are mobilized, they're ready to go, and they're going to need more funding to make this happen.
And what about worldwide, and how did it make its way here?
You know, we've had a lot of travelers that have gone to endemic areas like Brazil and other places. Even in U.S. territories like Puerto Rico, it's becoming more and more prevalent. The one thing to remember here in the U.S., we have the mosquitoes, but the virus is not in the mosquitoes yet. It may be that this summer. However, most of the cases in the U.S. have been transmitted by travelers, folks that have gone to endemic areas and come back.
Yeah, I was going to say there's roughly, what, 672 confirmed cases in U.S. territories such as Puerto Rico, and then also included in the United States. But pregnant women, 64 pregnant women impacted so far?
That's exactly right. And for pregnant women, this can be devastating. You know, we've learned in the last week now that not only does it associate itself with microcephaly, these really children that are born with small brains and underdeveloped brains, but also with blindness and premature births. And there's also some things that we're seeing in adults, such as Guillain-Barré, which is a paralysis syndrome, and now another disease that's very similar to multiple sclerosis, all being associated with Zika infection.
Okay, so what do we need to do to try and avoid this?
You know, I think the biggest thing is we've got to, in areas that are endemic to mosquitoes, we've got to come up with public ways of eliminating mosquitoes or controlling these populations. I think we need to educate the public about the fact that this can be sexually transmitted if you're infected with Zika, and pregnant women need to make sure that they don't contract the disease. I think that we've got to really redouble our efforts to make a vaccine as well.
And how likely and when do you think that vaccine will be available?
Based on my sources, it looks like we're making good progress, and September of this year is a target date for the vaccine. We also need a rapid blood test so we can quickly identify people who have this disease, because 80% of people don't even have symptoms.
Well, yeah, and what are those symptoms finally?
You know, they're very vague. Red eyes like you have pink eye conjunctivitis, muscle aches, fever, maybe a rash. Very nonspecific, typical viral illness.
All right. Dr. Kevin Campbell, thank you very much for joining us and giving us some more information on it.
Thanks so much for having me.